also know that the medical profession is also very exclusive in many ways, socially and conceptually. If a better solution is not a drug, then it is usually not considered a realistic solution. Again, nutrition is excluded categorically, even though nutritional therapy has been shown to provide benefit even for purely genetic disorders such as sickle cell anemia. Another aspect of the medical paradigm is that the ends justify the means. So this is what I call illogical proportionality. Serious diseases require serious, that is, expensive and risky treatments. And I think this model of ends justifying the means also accounts for some of the abusiveness that we see in medical education. Also within the medical paradigm is hierarchy of command and thinking, the deference to specialists, which of course sometimes is highly appropriate. However, generally speaking, within medicine, most of the decisions are made by authoritative groups and published in major journals, and so doctors have to comply with the so-called standard of care and so-called approved treatments. So again, medicine is very hierarchical. It is decided upon by authoritative groups, implemented by physicians, and then followed by compliant patients and students. Very little deviation, very little customization, and very little independence of thought. And number 7, finally for this page, the medical paradigm is very fatalistic. When a person has a disease, the disease has the person, and fate is pretty much predictable and certain. So we say, for example, that a person has diabetes, and many articles, even in modern times, have been published saying that diabetes is irreversible and must be managed by drug therapy alone. In contrast, in the naturopathic and functional medicine paradigm, we see that the same diabetes described as irreversible in medical journals is described as curable within other specialty journals, especially within the field of nutrition. So what I'll do on this page is contrast the paradigm of drug medicine, as I might call it here, against functional and naturopathic medicine. So again, the so-called standardized or so-called conventional medicine that most of us learn in medical school is very disease-centered. In contrast, functional medicine and naturopathic medicine is patient-centered. We use nutrition, for example, to change gene expression rather than think our patients have genetic diseases that we can never influence. And I already made brief mention of the condition sickle cell anemia, which we all know is a genetic disease, but with skilled nutritional intervention, we can change gene expression with the clinical use of selected nutritional supplements. Whereas drug-based medicine, or so-called standardized, so-called conventional medicine, is drug-centered and focuses on isolated molecular targets, functional and naturopathic medicine are both nutrition and lifestyle-centered for their interventions. Very nuanced and detailed, and the goal is to improve health and function of the entire organism, not simply impact isolated molecular targets and pathologized pathways. The medical paradigm is very self-affirming. It affirms that its treatments are the best: drugs, surgery, radiation, vaccines. In contrast, in functional and naturopathic medicine, we affirm the patient and we affirm whatever treatment is best for our patient. Whereas drug-based medicine is very self-affirming, in functional and naturopathic medicine, we affirm what is best for our patient and we affirm whatever has the best efficacy. And again, we all know that standardized medicine is very exclusive. It includes its own treatments, but excludes everything else that's outside of medical training, most obviously nutritional interventions and nutritional supplementation. In contrast, functional medicine and naturopathic medicine are inclusive of all ideas and interventions that help to improve the health of our patients. In standardized medicine, we think that serious diseases require serious treatments. In functional and naturopathic medicine, we think effective treatment requires the physician's skill and the patient's involvement, but we don't necessarily believe that a serious disease requires serious treatments. That's illogical. That is a clinical logical fallacy. So serious disease requires effective treatment. Serious disease does not require serious, expensive, and risky treatment. In medicine, everything from the way we're trained to the way that we treat patients is based on illogical proportionality, and that is the ends justify the means. In functional and naturopathic medicine, we again believe that effective treatment requires the physician's skill and the patient's involvement. Again, the emphasis is on clinical efficacy and maintaining patient autonomy and respect, rather than thinking that, again, a serious disease has to require a serious, risky, and expensive treatment. Also, specific to naturopathic medicine is the concept of the hierarchy of therapeutics. I'll mention that one more time in just a moment. But the hierarchy of therapeutics is a very important concept because what we do in naturopathic medicine is we start with the least invasive intervention possible. Usually that's botanical medicines, nutritional intervention, diet, and lifestyle, before we would think of going on to using drugs or even surgery. And I'm sure, as we all know, in so-called conventional or standardized drug-centered medicine, drugs are primary therapy. So a patient with a health problem can expect to have their nutritional needs ignored and to have drugs prescribed on the first visit when they see a so-called standardized or conventional medical practitioner. Again, the medical paradigm is very fatalistic. People have their diseases, and often they are told they will always have their diseases. In contrast, in naturopathic and functional medicine, we are positivistic rather than fatalistic, and we think we can change these conditions for the better. This is much less medieval thinking and thinking that's more in accord with the Enlightenment and Renaissance. In standardized medicine, again, hierarchical compliance is most important. The doctor complies with the guidelines and the patient complies with the doctor. In functional and naturopathic medicine, accuracy and effectiveness are most important. In so-called conventional or standardized medicine, surrogate markers are commonly considered more important than patient outcomes, whereas in functional and naturopathic medicine, patient outcomes are most important, while we also responsibly manage risk factors, laboratory results, etc. A really good example of where surrogate markers are considered more important than patient outcomes was a recent publication using vitamin C in septic hospitalized patients. The study had two major findings. One is that vitamin C did not change parameters of organ function, and number two is that patient mortality was reduced by approximately 50% in the patients who received vitamin C. The conclusion of the study was that vitamin C was inefficacious because they focused on surrogate markers rather than the successful patient outcome of reducing mortality by 50%. Also, you'll notice that the language of the interventions used in medicine are very different from the language that we use in naturopathic and functional medicine. In so-called conventional or drug-based medicine, we block receptors, we block enzymes, and we interfere with pathways. Whereas in naturopathic and functional medicine, we support processes and we improve physiologic function. So I'll invite you to take a look at this page and contrast so-called standardized or so-called conventional medicine with functional and naturopathic medicine. So a lot of times what we've seen is that as doctors move from a drug-based model to a functional systems-based model, for them they really experience a paradigm shift that changes their entire perception of clinical practice, medical care, and healthcare.